is Tatum. I'm going to be your nurse today. First off, I just want to say congratulations to you two. I'm just going to do a quick assessment on the newborn real quick. Is that okay? Awesome. First, I'm just going to grab some vital signs. So I'm going to take his pulse first. All right, I'm getting 120. And for his respirations, I'm getting 40. And his temperature, I'm going to take underneath his arm here. And that's 97.8. So they're all within normal limits. That's good. First, on general appearance of the baby, I am seeing that the skin is pink. There is some acrocyanosis in the hands and the feet, which is normal. That should go away on its own. I'm also seeing some lanugo present on the shoulders here. The skin is warm and dry and intact as far as I can see. Now I'm just going to take a look at the head first. So I'm going to grab a head circumference measurement. All right, so the circumference of the head is 13 inches. Now I'm just going to take a look at the head and the scalp here. So I do see some swelling present and some capit, which is normal after birth. The swelling should go down. And then I also don't see any of the sutures overlapping, which is good. And I don't see any other complications in the head. There is a little bit of hair present as well. And now I'm going to take a look at the face. As far as the ears, I do see that they are well formed and they're in the correct place. It looks like the nares are patent and the mouth is patent. I also see pink mucosa of the mouth and the nares. Now I'm just going to take a look at the chest and the clavicle. I'm going to feel it first. So the clavicle is intact and there is no breaking. I also see that the chest is rising and falling equally. The skin is intact as well on the chest. I'm going to take a measurement of the chest as well. All right, that measurement is about 12 and a half, so that is normal. It should be slightly smaller than the head. I also do note some milia present on the nose and the cheeks as well. Now I'm just going to listen. So first I'm going to listen to the infant's heart, and then I'm going to listen to the lungs. So I will be listening to the heart for about a minute. All right, and then it has passed. I did hear S1 and S2 heart sounds. There's no heart murmurs present. I'm now going to listen to the lungs. And I'm going to listen to the back as well. All right, all lung sounds are clear. I don't hear any wheezing or crackling in the lungs. Now I'm going to take a look at the abdomen. So as far as appearance of the abdomen, I do see that it is soft and is non-distended. I do note 2 arteries in 1 vein in the umbilical cord, and it looks like there is the skin around the umbilical cord is dry, and I do note a little bit of an umbilical hernia, but as when I press it, it is soft and it goes back into the stomach. So there's no nothing to worry about there unless it gets hard, then we have to have a doctor come in and look at that. But right now he's okay. Now I'm just gonna listen to the abdomen, the bowel sounds. All right, I hear bowel sounds in all 4 quadrants. Has the baby had a bowel movement since birth? He's had 1. Okay, awesome. Now I'm just going to take a look at the groin and the genital area. So for the hips, I'm just going to maneuver them and make sure I don't hear any clicking. All right, I don't hear any clicking in the hips. I'm going to take a look at the genitalia now. So it looks like the baby does have some hydrocele, which is just enlargement of the testes, which is normal after birth. It does feel like the testes are distended. There is some rugae present. It looks like the penis is straight, and I do see that the foreskin is covering the glands. Now I'm going to take a look at the baby's back. So it looks like the spine is straight. I don't see any tufts of hair or any sacral dimple. I'm gonna look at the extremities now. So I do see 10 fingers and 10 toes on the hands and feet. It looks like all of the nail beds are pink and capillary refill in each of them is less than 3. Now I'm going to just do all of the reflexes for the babe. So I'm going to do the sucking reflex first. So I'm going to change my gloves, put a new one on. I'm just going to put my finger in the babe's mouth and he instantly starts sucking. So that reflex is present and intact. Now I'm just going to check the rooting reflex. So I'm going to gently stroke the cheek and he does turn, so that is present and intact. I'm going to check his grasp. So he does grasp both of my fingers when my finger is placed in his palm. I'm going to check his Babinski. All right, the Babinski reflex is intact in the feet. Now I'm going to check the Moro reflex. So I'm going to lift the baby up and place him back down gently. And he does go out and in, which is positive, and the reflex is present and intact. And the last reflex I'm going to check is just going to be the step and dance reflex. So I'm going to lift the babe, and then he is going to dance or step down. Perfect. So that is present and intact as well. All right, that concludes the assessment. Do you have any questions for me right now, or can I get you either of you anything? Perfect. All right, I'll be back soon to check on you.